provide the funding that we need to save this health care. This is an aging community, and we need people, we need beds for these seniors that we house right now. Where are they going to be when we're done our 5-month layoff?
In our acute care beds.
Exactly. So we need people to rally around. We need support from the community. We need to get the word out there. We need Lou Rinaldi to step up to the plate.
There was a meeting, an informal meeting of concerned citizens that met following the Ontario Health Coalition meeting last Wednesday at the community centre. We've formed an action plan of 6 things that we wanted to do. The Central East, Lynn, is meeting on Tuesday to discuss these cuts, and they are on the table at 2:30 in the afternoon. So we would like as many people as possible to attend the meeting in Oshawa. It is an open meeting, but we understood that it would be difficult for everyone to attend. Therefore we wanted something locally that people could attend to express their feelings about the proposed cuts, so that we could get the message to the Lynn that we do not want these cuts.
11 hospitals have received rescue funding from the Ontario government this winter, totaling almost $70 million. Our hospital has been prudently managed. Our problems come from underfunding and not inefficiency. It is time that Queen's Park steps up to the plate. There's been lots of rhetoric about moving services to areas and places where they can be delivered more efficiently. The health minister, she's commented on hospital layoffs by stating that she's actually improving health care. But the reality is these services are not being moved to another agency, they're being cut. And these cuts will affect our diabetes patients. It'll make it difficult to find publicly funded occupational therapy and physiotherapy services. It'll be difficult to find a bed in the hospital. More patients, ALC patients, will be moved into the home care system, which is unable to support them. Patients will remain on lengthy wait lists for long-term care.
Each RN cut, it's 1,950 hours of patient care cut in a year. For the numbers they have proposed here at Northumberland Hills Hospital, it's a total of 30,000 RN nursing hours for 1 year.
Yay! Other things people can do, they can attend the Lynn meeting tomorrow. They could write the chair of the Lynn and express their opinion to him before the Lynn meets tomorrow. There also is an online petition that people can register to. Other things that people could do would include becoming a member of the hospital. It's very important that people become a member of the hospital. It's only $10. If you go upstairs to the 2nd floor to the finance department, you can pay your $10, become a member before mid-April, and then you will have the opportunity to vote at the June 17th AGM. That vote will determine who will become members of the board next year, making the further decisions about the operations of this hospital.
As somebody who lives in Port Hope, this is a community. I want to give recognition for the efforts that Port Hope went to and sacrifices, how they feel, to help build this hospital. And it was, it was a very trying time. But, you know, many of us went together, supported the leadership of both communities to build this hospital. And here we are today, facing the very thing we were promised when we sacrificed our own hospital, that this wouldn't take place. And here we are, and it's taking place. And I just want to thank everybody, because we're here to give them a message that we're not going to take this. And this rally probably won't do the trick. And going tomorrow, which we need to go as many as possible, on Tuesday won't do the trick. So I just want to remind people we are meeting at the Lions Center in Coburg at 5:30 to discuss our next plan. And I ask that all of you join us. It is a totally nonpartisan event, so we can have as many people from the community to join us and show people we need our hospital, we didn't cause a deficit, and it's time that we stood together and told them, you either keep our hospital going or you won't be on the board. And we'll also discuss what will happen in the next provincial election.
Do you understand that the most vulnerable people are the ones that are going to suffer the most here? It's single mothers who have to travel to other facilities to get the service they're accustomed to. We need to stand up and protect the jobs that we have here, the services that are offered in these communities. This is going to be something that's going to go throughout Ontario. What I urge people to do is, in solidarity, stand together with all unions, all the common people, special interest groups as we're called, labor councils, whatever it takes to protect our services.
The last thing, and very importantly, we would like everyone to attend the community meeting Thursday at 5:30. So once we know what decision the LHIN has made on Tuesday, we will be able to have an opportunity to get together and try and come up with some solutions as a community on how we will move forward to save the hospital cuts, prevent them from happening, and come up with some alternate solutions.